Welcome back to the Aslan Health Podcast. I'm Dr. Mike Hauman. This is the second episode in our three-part series on fish oil supplements and omega-3 fatty acids. Last time, we revealed the important details about fish oil and why it's essential for your health. We talked about EPA and DHA, why they differ, and how they support cell membranes, triglyceride metabolism, brain and eye health, mood, and the resolution of inflammation. Today, we reset your thinking by asking these very practical questions about your fish oil supplement. Do you really need it? How much EPA and DHA are you actually getting? Is your product fresh? Is it oxidized or rancid? Are you taking it safely? And does it fit into your larger goal of health stewardship? I promise you, there's nothing even remotely fishy here. We'll swim against the marketing current and reset your fish oil facts. Let's go.
Welcome to the Aslan Health Podcast, where science meets soul. Your host for this program is Dr. Mike Hauman, an experienced physician, a certified functional medicine provider, a certified insight coach practitioner, and a devoted follower of Jesus Christ. If you're tired of feeling stressed out, exhausted, overwhelmed, or stuck in survival mode, you're in the right place. So take a deep breath. Let's be transformed by the renewing of our minds. Here's Dr. Mike.
Today, we'll get right at it with 9 important principles to help you achieve the best possible outcome for your health. Reset principle number 1. Start with real food, not supplements. The foundational recommendation is simple. Eat fatty fish about 2 to 3 times per week if you tolerate it, enjoy it, and it fits into your dietary convictions and health needs. Good choices in this category include salmon, sardines, anchovies, herring, trout, and mackerel. These fish provide EPA and DHA along with protein, selenium, iodine, vitamin D, and other nutrients all together in a natural way. Food is beautifully complex and lovingly created for our good. A supplement capsule is concentrated and convenient for sure, but whole natural food has always been God's intended way for us to acquire our nourishment and nutrients. Friend, use supplements to supplement, not as a substitute for sustaining superb nutrition. If you eat fatty fish consistently, you may not even need to consume fish oil. But if you're allergic to fish, dislike it, rarely eat it, or have low omega-3 status, supplementation may be appropriate for you. Reset principle number 2. Know your goal. Please do not take fish oil just because someone on the internet said that their new formula is good for you. That's not wise. That's digital peer pressure. Before taking fish oil, identify your reason to supplement. Are you trying to fill a dietary omega-3 gap? Or to support triglyceride metabolism? Or your inflammatory balance? To support your brain, mood, or general wellness because you do not eat fish? Each goal may require a different dosage, different EPA to DHA balance, and different level of medical supervision. My recommendation for general omega-3 support is to use a product providing roughly 500 to 1,000 milligrams per day of combined EPA and DHA. That's combined EPA plus DHA, not total fish oil. And for a more targeted approach, use 1,000 to 2,000 milligrams per day of combined EPA and DHA, depending on your goal and your health context. For triglyceride lowering, clinically meaningful doses are often much higher, commonly in the range of 2,000 to 4,000 milligrams per day, and that should be done with medical guidance only, especially when triglycerides are very high or your cardiovascular risk is significant. It's important to note that prescription omega-3 products are different from over-the-counter supplements. Prescription products are regulated as medications. They have defined dosing, defined purity, and specific clinical indications. That requires a consultation with your personal healthcare provider. Reset principle number 3. Read the label before you purchase the bottle. The front of the bottle may say 1,000 milligram fish oil. That sounds impressive, but turn the bottle around. Look for EPA and DHA, then add those numbers together. For example, a label may state that each capsule contains 1,000 milligrams of fish oil, but lists EPA 180 milligrams, DHA 120 milligrams. That means the total content of EPA plus DHA is 300 milligrams, not 1,000 milligrams. So if your goal is 1,000 milligrams per day, you would need more than 3 capsules, which no longer makes that product such a bargain. I find that this is one of the more common fish oil mistakes, using total oil instead of EPA and DHA content together. Reset principle number 4, choose the right balance. You don't need to become a lipid biochemist. Here's a simple way to think about it. EPA is often favored when the goal is inflammatory balance, triglyceride support, and mood support. DHA is particularly important for brain structure, eye health, pregnancy, breastfeeding, and neurodevelopment. So, a balanced EPA-DHA product is reasonable for general wellness support. An EPA-dominant product may be preferred for mood or triglyceride-related goals, and a product that favors higher DHA may be appropriate if your focus is on pregnancy or lactation support, brain structure, or eye health. Individuals that prefer not to consume fish oil can use algae-derived omega-3 products, things such as krill oil or algae oil, which provide EPA and DHA mostly in the phospholipid form. I find that it's easier for sensitive individuals to tolerate, but it often provides lower total EPA and DHA per capsule, so it can be slightly more expensive as a result. Don't choose based on what's trendy or has an appealing package. Choose based on your goal, purpose, dose, product quality, and tolerability. Reset principle number 5. Take fish oil with meals. EPA and DHA are fats. They are absorbed better when taken with a meal that contains fat. Taking fish oil on an empty stomach may increase your side effects like fish burps or nausea, esophageal reflux, as well as lead to poor product absorption. In fact, statistically, bioavailability can increase by about 3-fold for some products when they're consumed with a high-fat meal versus on an empty stomach. So, always take your fish oil supplements with your largest meal when possible. If you're prone to reflux, try taking your capsule in the middle of your meal or using an enteric-coated form. If you're prone to fish burps and feel like you're tasting fish all day, that's not something that you need to live with. It may be poor tolerance, poor timing, or poor product quality. Dose with meals or change your product choice. Reset principle number 6. Quality matters much more than price. Fish oil can easily oxidize. That means the oil can react with oxygen and begin to break down. This process can create unpleasant odors and a foul taste. It reduces freshness and impedes the expected health benefit that you'll receive from the product. A high-quality fish oil product should not smell like a forgotten bait bucket that accidentally spent a week in the trunk of your vehicle. A strong rancid odor, harsh fishy taste, sticky capsules, cloudiness in the product, and repeated fish burps can be warning signs that your product needs an upgrade. Here's what to look for before your next selection. First, third-party testing. Look for independent testing for purity, potency, and oxidation. Helpful certifications for testing programs may include the IFOS, USP, NSF, Consumer Lab, or other reputable third-party verifications. Second, look for transparency of EPA and DHA content. The label should clearly state the amount per serving of each. Third, look for contaminant testing. Your fish oil should be purified and tested for heavy metals like mercury, as well as PCBs, dioxins, and other contaminants. Fourth, look for oxidation testing. Good products from reputable companies proudly display their oxidation limits and their testing results. Fifth, consider packaging. Dark glass bottles, opaque containers, blister packs, smaller product bottles, and proper container sealing can all help reduce oxygen in light exposure, all of which improves the product that you consume. I would not eat fish that sat out unprotected in direct sunlight for several days. Would you? Sixth, check expiration dates and storage instructions for your product. Please, don't buy the jumbo bargain bottle if it will take you 2 years to finish it. That will cost you in the end. Freshness with fish oil matters a great deal. Only purchase amounts that you can use within a reasonable time frame and store your product according to the label directions. Liquid fish oil should be refrigerated after opening. Soft gels may do okay in a cool, dark place, but heat and sunlight are not fish oil friendly, so don't store them in your car or by a heat source or near a sunny window. Reset principle number 7. Consider the form, but don't obsess over it. Fish oil can come in several forms: natural triglyceride, ethyl ester, re-esterified triglyceride, free fatty acid, and phospholipids such as krill oil. In general, triglyceride, free fatty acid, and phospholipid forms are better absorbed than the ethyl ester forms, especially if taken without a fatty meal. Statistically, the re-esterified triglyceride formulations have the highest bioavailability. But all forms can raise EPA and DHA levels when they're consistently taken at the proper dosage. That means the right form of the right product at the right dose for the right reason. Reset principle number 8. Know if you personally need to proceed with caution. Fish oil is generally well tolerated, but higher doses are not automatically safe for everyone. Please speak to your healthcare professional before using fish oil if you have a fish or shellfish allergy, a bleeding disorder, or you take blood thinners or antiplatelet medications. Seek your provider's opinion if you have a pending surgical procedure, very high triglycerides, liver disease, a complex cardiovascular history, a history of atrial fibrillation or significant heart problems, and certainly if you're pregnant or breastfeeding. If you do initiate fish oil supplementation, as always, monitor your response. If you develop bruising, nosebleeds, bleeding gums, new palpitations, worsening reflux, a rash, or other significant symptoms, stop and seek appropriate professional guidance. Not out of fear, but out of wisdom. Proverbs 14 verse 15 says, "The simple believes everything, but the prudent gives thought to his steps." This principle applies here. The simple believes everything. The prudent gives thought to his steps. Marketing proclaims, "Everyone needs this." Fear screams, "No one should take this." Wisdom says, "Think carefully, gain understanding, consider what is wise, then choose what is best." Reset principle number 9. Do not use fish oil as a feeble excuse to avoid making deeper lifestyle changes. That's important. I've found that some patients want fish oil to do what repentance, routine, rest, and relationships are supposed to do. They want a supplement to compensate for overwork, poor sleep, excessive stress, inflammatory overload, poor food choices, inactivity, and an utter disregard for meaningful margin. Friend, fish oil is not a permission slip to ignore your essential health and wellness foundational habits and choices. If your triglycerides are high due to poor dietary choices or metabolic syndrome and a sedentary lifestyle, fish oil may slightly improve your numbers on your next blood lipid panel, but it does not address the root cause of your overall unhealthy pattern. If your inflammation is high because you sleep less than 5 hours a night, you live on ultra-processed food, and you never recover from overwhelming stress, well, fish oil may help some, but your body is asking for a total reset, which is much more than any supplement can provide. So here's a practical framework for the Aslan Health Omega-3 Reset Protocol. I encourage you to download your free copy from today's show notes to guide your decision-making. Step 1. Assess your intake. How often do you eat fatty fish? If the answer is twice weekly or more, you may not need a supplement. If the answer is rarely or never, implement a food-first approach and then consider supplementation if you need to. Step 2. Clarify your omega-3 supplementation goals. Is it for general wellness support, reduction in triglycerides, or your total inflammation? Is it for your brain, mood, or eye support? What is your goal? Step 3. Choose your target EPA-DHA dosage. For general support, consider roughly 500 to 1,000 milligrams combined EPA and DHA daily. For targeted support, consider 1,000 to 2,000 milligrams daily. For triglyceride management, do not self-prescribe higher doses. Work with your clinician and acquire blood lipids to track your progress. Step 4. Choose a high-quality product from a reputable source. I have included my favorite products in the downloadable product guide found in today's show notes. All of these products are accessible in the Aslan Health Fullscript storefront as well. Step 5. Take fish oil supplements with meals. Preferably a meal containing fat. Absorption and incorporation will be optimized as you align your fish oil supplement consumption with the pattern of natural whole food digestion. Finally, track your body's response. For triglycerides, recheck your labs in 3 to 6 months or as directed by your ordering provider. For inflammation, track your joint stiffness, your pain, and your functional improvement over 30 to 90 days or so. The same for mood and cognitive improvement goals. For the goal of general wellness, consider requesting omega-3 index testing if you want objective data to determine if the supplementation could provide potential health benefits based on your baseline profile. God is not honored by our gullibility, our ignorance, or our neglect of good counsel. He calls us to wisdom. James 1:5 states, "If any of you lacks wisdom, let him ask God, who gives generously to all without reproach, and it will be given to him." That is a comforting verse. There's a God who cares. You do not have to make health decisions alone. You can ask him for wisdom. You can seek counsel. You can learn, understand, and choose well for the body that he has provided for you. So this week, here's your reset assignment. If you do not currently take fish oil, ask yourself the 2 questions. How often do I eat fish that's high in omega-3s? And should I consider a fish oil supplement? If you are currently taking a fish oil product, look at the bottle, observe, and then ask yourself a few questions. Write down the EPA and DHA per serving. Check your product expiration date and sniff test the contents. Then ask, why am I taking fish oil? What's my goal? And is this product the right dose of EPA and DHA for me? Check to see if your product's been third-party quality tested. Well, in our next episode, we'll renew with a long-term omega-3 strategy. We'll talk about how to make this sustainable, how to pair foods and supplements wisely, when to test and retest, when to stop your supplement, and how to practice stewardship without obsession. This is Dr. Mike Hauman. Thanks for joining me on the Aslan Health Podcast. Please subscribe and follow on your favorite platform for ongoing weekly episodes. Also, consider subscribing to the free Aslan Health newsletter, emailed to your inbox each Wednesday. Until next time, may your mind be renewed by the truth, your body strengthened with compassionate care, and your heart encouraged in peace, by the gracious one who gives wisdom generously to his children without finding fault. May he guide your steps, guard your thoughts, and grant you clarity as you seek to steward your health with faithful discernment. His blessings to you, my friend, both now and always.